So let's talk about APGAR score. Like APGAR score. APGAR score is an assessment tool that is used to assess newborn within the first 1 minute to 5 minutes of their birth. And this is usually done to assess if there's any issue with the baby, with the newborn. And this APGAR score was developed by Dr. Vaginal APGAR. So this acronym is from the name APGAR, and each letter has a meaning. Like A is appearance, P is pulse, G is Grimace, activity, and R is respiration. So each table has a meaning. So before we go into details questions on APGAR score, I would like to explain what it is. So if the baby appears blue, meaning that the child has a 0 mark. If the baby has a pink body and blue extremities, like the hand, the feet is blue but the body is pink, the baby will have 1 mark. If the baby appears pink, the baby will have 2 marks. Do you understand? So each one is 2, 2, 2, 2, 2. That makes 10 in total. So the pulse, if the pulse is 0, the child will have 0 mark. If the pulse is less than 100, the baby will have 1 mark. If the pulse is greater than 100, the baby will have 2. So if the pulse is, Grimace, what is Grimace? Grimace is at the movement to stimulate. If they stimulate the baby, there's the movement. So if there's no movement after stimulation, it's absent, the child will have 0. But if there's minimal response after stimulation, it will be 1 mark. So if there's rapid, a prompt response after stimulation, the child will have 2. So the activity is like how they respond. Are they active? Is it that they are just floppy? So like when the baby is touched, just like it's floppy, the baby will have what? 0 mark. So if the baby is slow, there's the movement but deflection is slow, the baby will have 1. So if the child is active, like imagine you just drop the baby suddenly and carry the baby, how did they respond? So it's 2. The respiration, if there's respiration, the baby is breathing, is not breathing, so if breathing is absent, it will be 0. So if there's weak, is irregular, it will be 1. But if there's good, the baby is crying, when the baby is crying, shows that they are respirating right. So at birth, that's a newborn, so it will be 2 marks. So a child, by the time we had everything, it's supposed to be over 10. Yes, over 10. So if a child has between 0 to 3, is low. But if a child has between 4 to 6, it's moderate. But if a child has between 7 to 10, that's a good mark. Yes, it's a good mark. So if a child has between 7 to 10, that's a good mark. So I hope you understand. So we're going to a scenario. So see you in our next video.